How Parkinson's disease affects the body. Life with Parkinson's is challenging, to say the least. This progressive disease starts slowly, and because there's currently no cure, it gradually worsens how you think and feel. Giving up may seem like the only solution, but it certainly isn't. Thanks to advanced treatments, many people are able to continue living healthy, productive lives with Parkinson's. Parts of the body affected by Parkinson's disease: head, memory function, cognitive impairment, behavioral problems, changes in personality, fatigue, hallucinations, trouble sleeping, difficulty swallowing, chest pain, depression, difficulty sleeping, stomach, digestive issues, urinary problems, constipation, legs, trouble balancing, decreased range of movement, joint and muscle aches. Patients' facts: 50 to 80% eventually experience dementia. 50% have some form of depression. Up to 80% experience constipation. Parkinson's patients are 3x more likely to fall. Parkinson's is sometimes perceived as a mystifying disease. The stigma surrounding it has led to numerous misconceptions. This list debunks the top 5 myths about Parkinson's. 1. Myth: Parkinson's only affects you physically. Some of the earliest warning signs and symptoms of Parkinson's are tremors, loss of mobility, and poor balance, all of which are motor symptoms. But non-motor symptoms, including change in speech and personality, increased urinary frequency and urgency, and cognitive impairments, are also symptoms of the disease. 2. Myth: only older people can be diagnosed with Parkinson's. While the majority of those with Parkinson's are over the age of 62, it's entirely possible to be diagnosed earlier in life. Young-onset Parkinson's occurs when an individual receives a Parkinson's diagnosis before they turn 50. It's believed that only about 2% of the 1 million people with Parkinson's are younger than 40. 3. Myth: it's a predictable disease. If Parkinson's were predictable, then it would likely be curable too. Similar to many other progressive diseases, Parkinson's varies from person to person. How fast the disease progresses and how often symptoms are experienced are different for each individual with Parkinson's. Alongside this, there's no way to predict who will receive a diagnosis. 4. Myth: besides taking any prescribed medications, you can't do anything to help with treatment. Although any lifestyle modifications you make won't change your Parkinson's diagnosis, eating healthy and exercising can be beneficial treatment add-ons. The Mayo Clinic recommends a well-rounded, balanced diet full of fiber and wholesome foods. Staying active can help you maintain a sense of independence, as well as increase your muscle strength and flexibility. Ask your doctor for specific eating and exercise recommendations. 5. Myth: once you're diagnosed with Parkinson's, there's little to no hope. Parkinson's may be a progressive disease, and it may be incurable, but that's no reason to miss out on life. Researchers are looking for advanced treatments to stop the disease and even prevent it from happening in the first place. For example, in June 2015, the U.S. Food and Drug Administration approved the Brio neurostimulation system. This deep brain stimulation device sends pulses through the body to reduce symptoms, such as tremors. Other advanced treatments are also in the works, so the promise for a cure is on the horizon. Why you should be eating more porcini mushrooms. Aside from being rich in valuable nutrients such as fiber, vitamins B and C, calcium, potassium, phosphorus, magnesium, selenium and zinc, mushrooms are also excellent sources of antioxidants, including some that are entirely unique to mushrooms. Ergothioneine and glutathione, both of which are found in mushrooms, are recognized as master antioxidants that inhibit oxidative stress. Both are considered important anti-aging compounds. As noted in The Guardian, as scientists think, ergothioneine and glutathione may help to protect the body against the maladies of old age, such as cancer, coronary heart disease and Alzheimer's disease. Ergothioneine appears to have a very specific role in protecting your DNA from oxidative damage, while glutathione is important for successful detoxification of heavy metals and other contaminants. According to Robert B. Ellman, Professor Emeritus of Food Science and Director of Penn State Center for Plant and Mushroom Products for Health. See countries that have more ergothioneine in their diets. Countries like France and Italy also have lower incidences of neurodegenerative diseases, while people in countries like the United States, which has low amounts of ergothioneine in the diet, have a higher probability of diseases like Parkinson's disease and Alzheimer's. Now, whether that's just a correlation or causative, we don't know. But it's something to look into, especially because the difference between the countries with low rates of neurodegenerative diseases is about 3 milligrams per day, which is about 5 button mushrooms each day. Porcini mushrooms, an antioxidant powerhouse. While all edible mushrooms have beneficial properties, some are more potent than others. As noted by Bielman W. Without a doubt, mushrooms are the highest dietary source of these two antioxidants taken together, and some types are really packed with both of them. When it comes to the antioxidants ergothionane and glutathione, wild ceps, Boleta sedulis, commonly referred to as porcini mushrooms, contain the highest amounts. Bielman and colleagues at Penn State measured levels of these two antioxidants in 13 different species of mushrooms, and wild porcini mushrooms were the clear winner. That said, even the white button mushroom contains more of these antioxidants than most other foods. They also found that mushrooms high in glutathione are also high in ergothionane, so the two appear to be correlated. More good news, ergothionane and glutathione are heat stable, so cooking your mushrooms does not significantly affect their health benefits. With a strong, nutty flavor, porcini mushrooms are commonly found in Italian dishes and are a favorite among gourmet chefs. The dense and meaty porcini mushroom cap can grow to a diameter of 12 inches, and a mature specimen can weigh as much as 2 pounds. Wild porcini is found in hardwood forests, as they form a symbiotic relationship with trees. The mycorrhizal fungi with their hyphae, long, branching filamentous structures, help shuttle nutrients to the tree's roots, while the mushrooms are nourished by plant sugars. Porcini mushrooms are not mass cultivated since their mycorrhizae need the symbiotic relationship with other plants to thrive. Porcini mushrooms offer potent immune support. Porcini mushrooms also contain a number of compounds that modulate and strengthen immune function. This is one reason why they're so beneficial for preventing and treating cancer. Immune-regulating compounds include not only vitamin D but also long-chain polysaccharides, which have a variety of beneficial properties, including anti-inflammatory, hypoglycemic, anti-ulcer, anti-tumorigenic, immunostimulating. Alpha and beta-glucan molecules are among the most important polysaccharides. Beta-glucan in particular enhances immunity through a variety of mechanisms, many of which are similar to those of Echinacea or Astragalus root. For example, it binds to macrophages and other scavenger white blood cells, activating their anti-infection activities. The beta-glucan in porcini mushrooms also plays a role in fat metabolism and may help support healthy cholesterol levels. Mushrooms also contain a number of other unique nutrients that many do not get enough of in their diet, including B vitamins like riboflavin, niacin and pantothenic acid, as well as copper, the latter of which is one of the few metallic elements accompanied by amino and fatty acids that are essential to human health. Since your body can't synthesize copper, your diet must supply it regularly. Copper deficiency can be a factor in the development of coronary heart disease. Other bioactive and medicinal compounds include terpenoids, steroids, phenols, and all of the essential amino acids. They're especially good sources of lysine and leucine. Lutein/zeaxanthin benefits more than meets the eye. An article appearing on February 15, 2017 in Nutritional Neuroscience reports a positive effect for supplementation with the macular carotenoids lutein and zeaxanthin on psychological stress, cortisol levels, and emotional and physical health in young men and women. The antioxidant nutrients are best known for their benefit in age-related macular degeneration, the leading cause of irreversible visual impairment and blindness among older Europeans and North Americans. The research involved 59 young adults enrolled in the Lutein, Vision and Mental Acuity 2, LAMA-2, randomized, double-blind trial that compared the effects of lutein and zeaxanthin to a placebo. Participants received 13 mg, mg, or 27 mg of a combination of lutein plus zeaxanthin, or a placebo daily for 1 year. Serum cortisol and macular pigments, macular pigment optical density, and behavioral data were assessed at the beginning of the study and at 6 and 12 months. At the trial's onset, macular pigment optical density was correlated with anxiety, symptom inventory and psychological stress scores, as well as with serum cortisol, which increases during stress. At 6 months, Psychological stress, serum cortisol, and physical and emotional health measures were improved among those who received lutein and zeaxanthin in comparison with a placebo. The outcomes were found to be maintained or further improved at 12 months due to a propensity to deposit in neural tissue of specific regions of the brain and eyes. Lutein and zeaxanthin may benefit both areas. This compelling research demonstrates the expanded benefits of supplementing with lutein and zeaxanthin isomers to help address the huge public health concerns surrounding elevated stress and cortisol levels, commented Abhijit Bhattacharya, whose company supplied the nutrients being tested. The results of LAMA2 serve as a strong foundation on which new macular carotenoid science can be built.